back to today. We'll start off, Eric, with the slides for today's data. And as you can see, sadly, the number of cases continues to go up. We're above 1,500 for the day. The average is now pushing 1,100. So we've seen this spike go up, and not something that we certainly want to see. 13 deaths reported since yesterday. There were 109 new hospitalizations, 11 new ICU admissions reported in the last 24 hours. Let's look, Eric, at the counties by incidence. We'll start with the top 20, and then we will look at the top 88. But if you look at the top 20, again, you'll find mostly rural counties. You'll find counties at the top that have 2.5 times to almost 3 times the number of cases for the last 2 weeks above what the CDC says is high incidence. So very, frankly, these numbers are very alarming. I want to take a moment to talk about the positivity. Positivity was going down for quite some time, and we were just delighted. Again, this is if you take the total number of cases for the day, the tests, and then you look at what percentage actually came back positive. To date, our lowest positivity was in mid to late September, when our single-day rate dipped to 2.5% several different times, and our weekly average was 2.7. And that was really great news. It was 2.7 for the week of September 18th. Today, our daily positivity was 3.9%, our most current day, and a 7-day rolling average is 3.3. Reflects the ongoing increasing trend of virus spread that we're seeing throughout the state of Ohio. So these numbers are not good. Eric, let's go to the public health alert system, and we'll look at our map. As you look at it, on your left is last week, to the right is this week. And you can see we're getting unfortunately, we're getting a lot more red in there. Eric, let's look at the next slide. So this is, as of today, we're announcing 18 red counties. The highest number we've seen since the week of July 23rd. And now there are 58 orange counties this week, the highest ever. The virus is spreading in more areas of the state and impacting a wider swath of Ohio. Again, as we talk to public health departments, what they tell us when they try to drill down on the causes of this spread, lax social distancing, not enough people wearing masks, not enough people following quarantine and isolation guidance. Let's look, Eric, at our next slide, if we could. What we've done with this slide is you will see that we've only put on the slide the red, which are the red counties, and the other counties that you see there in orange, I guess, those are high incidence counties. So if you're watching this at home, these would be the counties that if you live in one of these counties, you would worry about, because they have either they have a high incidence or they are a red county, which means they meet many of the seven indicators. So these are the counties that we're particularly most concerned about. Again, talking with local health departments, a lot of the spread we're seeing is being driven by everyday activities that certainly seem benign, seem innocent, having neighbors over for a backyard barbecue, meeting up with friends after a sporting event, or going to a birthday party with family. These are all some of the leading causes of the spread we're seeing. There's also increased spread among families and households, in churches, and at after-school activities and sports. We're seeing these gatherings many times are turning into outbreaks. In half of our new red counties, there are outbreaks related to funerals or weddings. Let me just say that again. In half of our new red counties, there are outbreaks related to funerals or to weddings. In one example, we heard about recently, and this is just absolutely breaks your heart. I'm not saying where it was, but somewhere in Ohio, a wedding took place. A lot of people, and ended up with two of the grandfathers of the couple died as a result of COVID. It is horrible. As of this week, 96% of Ohioans are living in a red or an orange county. That's 26% in our 18 red counties and 70% in our orange counties. Only 4% of Ohioans are in the 12 yellow counties. The portion of Ohioans living in counties with elevated risk levels has steadily increased since August, when we saw a lull in cases, as you can see from what's happened with this chart. To live with the virus, look, we need to adjust our routines. We can live with this virus, but we've just got to be very careful. That may mean reconsidering attending a crowded event, reconsidering going to a party. And if you happen to get sick, please help the local health department do the tracing that is absolutely crucial and necessary. Basic prevention measures hold true today as they did at the beginning of the pandemic. The basic principles are the same that we've talked about. Keep a distance, wear the mask, wash your hands, avoid big gatherings. It's the same things. We're going to look now specifically at our new red counties, and we'll start in order of incidents. And the first is Central Ohio and Fayette County. Fayette County now is almost at 3 times. In the last 2 weeks, they're almost at 3 times the high incident level of the CDC. They're at 291 cases per 100,000. They're red for the first time this week. They've just jumped up. Local health department officials told us yesterday that they have outbreaks in a small school, cases associated with a funeral, and a large family outbreak. As of yesterday, there were 8 residents hospitalized and 2 sadly in intensive care. Right here in Marion County. Marion County is red for the second time this week. Local health department officials said they're adding 10 to 15 cases per day, 10 to 15 new cases per day, and that several are connected to multiple outbreaks, including churches, daycares, and a dental office. They're also seeing multiple cases in families and a few cases in schools. Number 3, down into Lawrence County, southern tip of Ohio. Lawrence County returns to red this week for the first time since the week of July 30th. County health officials said they have had outbreaks associated with a funeral, after-school activities, and with church functions. The community has spread throughout. The local health commissioner said, and I quote, "The virus is running through families like I've never seen before." Let's turn back to Central Ohio, Madison County. Again, Madison County with a very high rate. They're red for the first time this week. Local health department officials said they are seeing high occurrence of spread in families. They attribute that in part to people starting to spend more time indoors. Ross County. Ross County is red for the first time this week. County health department officials said they're seeing a few cases associated with the prison and others associated with social gatherings such as backyard barbecues and overnight sleepovers. Cases have increased from 7 to 10 a day 3 weeks ago is what it was, now to 14 to 15 cases per day. Let's go up north to Portage County. Portage County returns to red this week. Local health department officials report that Kent State is partnering with CVS Health to provide free testing for students, staff, and faculty starting October 12th. So again, that's a great opportunity to get tested. Each week, 450 students will be randomly selected for testing. The City of Kent Health Department officials also report that in recent weeks, they're seeing cases start to creep into an older population, not just the students. And again, this is what we've been concerned with, not only concerned about the students and faculty, but then the spread out into the community. County Health Department officials also said they're seeing community spread. Over into the Mahoning Valley. Mahoning County is red for the first time this week. Health Department officials said they have had multiple outbreaks, including an out-of-county wedding with 18 associated cases ranging to other states and counties. The wedding now also has secondary spread associated with it. Two separate funerals have cases associated with them. There have been outbreaks tied to a group home and outbreaks tied to a birthday party. In addition to the large parties, there's been spread inside family units, and not necessarily the households where people live, but in extended families in other households. Health Department officials said that school districts have been doing an excellent job, as I think, pretty much throughout the state, in keeping the spread minimal. However, as we've said many times, our schools are a reflection of our communities. And if there is widespread spread in the community, the schools simply have no way of keeping it out. Also in the Mahoning Valley, staying in the Mahoning Valley, let's go to Trumbull County. Trumbull County increased from yellow to red this week. The county was last red the week of August 20th. Local health department officials report an outbreak of 22 cases with a school sports team. The outbreak involves 11 players, 3 coaches, and expanded to 4 students not on the team and 4 parents. 1 coach had to be hospitalized. School administrators have been very cooperative. The health department is assigning a nurse to work with the schools, but they have at least 1 case in a third of the school districts, at least 1 case in a third of the school districts in the county. There are also continued community events happening which can lead to increased virus transmission.